also featuring Nonik Tendai. It is now 10:28 Central African time. We are getting straight into it. I promised you that it's what we unpacking today, and we are going to do just that. Now, I do have Dr. Kalan, who is my guest and is on standby. Now, October in South Africa is Cancer Awareness Month, and the Cancer Association of South Africa, CANSA, has partnered with internationally renowned hair restoration clinic Alvi Armani South Africa to launch an initiative offering complimentary consultation and assessment to those recovering or recovered from cancer. For many, completing cancer treatment is an experience that brings immense relief. However, it doesn't always mark the end of an emotional journey. While chemotherapy and radiation often save lives, they can leave lasting reminders, and hair loss is amongst the most visible. The initiative will offer cancer affiliates patients in recovery access to complimentary, in-depth and personalized consultations. This may include scalp density and mapping assessment, as well as checks for lingering treatment effects. Where needed, survivors will receive advice and support with restorative hair treatment or transplant at Alvi Armani South Africa. I do have my guest, Dr. Kalan. Good morning, and thank you so much for joining us.
Good morning, Puleng, and good morning to all your viewers.
So, Doctor, can you tell us about this particular partnership with Alvi Armani as well as CANSA?
100%. Puleng, it makes me very humble to be able to talk about this initiative that's extremely close to not just my heart, but I think the entire Alvi Armani international team as well. I think for too long, and don't get me wrong, I mean, surviving the fight of cancer is the first and most important thing. Being able to call yourself a survivor, being able to combat and beat the disease process is always the first and most pertinent part of the journey. But why this partnership with cancer in particular becomes so important is because we've realized just with our general consultations and with seeing the patients that we see, not just here in South Africa, but in our international clinics as well, is that once someone has become a survivor, that technically isn't the end of their journey. Our sort of focus is to re-acclimatize these patients back into society, making them feel like themselves again now that they've become survivors and beating the cancer process. So, to simplify the entire journey, what we're trying to do is try and make people less aware that these are sick people. So, what I mean by that is, particularly when it comes to cancer, one of the severe complications is obviously hair loss. And even once someone has survived the journey, in a large variety of patients, the hair never grows back to its full sort of density, coverage, and caliber again. Because of the chemotherapy, because of radiation, all of these sort of treatments, which are critically important to fight the cancer, have to have some level of side effects. And this is particularly where we jump in to try and allow our patients to get back to normality every time they look into the mirror. They shouldn't be looking at themselves as a sick person anymore. And I think what I hear, particularly from our patients, both males and females, is a lot of people have their focus on the survivorship. And then once they've survived, it's almost like, but why do you care about your hair? I mean, you've just beaten cancer, you've just survived something horrific. Why are you even bothered about your looks? But I think it's not just about looks anymore. It's more about the psyche, the emotional toll that all of this takes on a person. And that is particularly why we are extremely proud to be able to partner with, I think, the largest nonprofit organization in the country, which is the Cancer Association, and being able to help a vast or a large variety of patients across the country.
So, doctor, why is it important then for a hair restoration clinic to be involved in this way? Because you already had your own clients. You were already an established business that is actually has a wider footprint. What is it about cancer patients that sparked the need for alignment?
I think first and foremost, Alvi Armani in itself has always been a company that needs to give back and wants to give back. So if we take from our head offices, which are based in Los Angeles, Beverly Hills, I mean, they had a similar partnership with a similar organization, but on that end of the world. And the minute we started noticing, and I would say, particularly in the last, call it 24 to 36 months, a large variety of patients are actually post-cancer patients or survivors, if we can call them that. And we had a one particular patient, and thankfully she's been very open for us to share the journey. So I'll be able to use a name as well. But there's a particular patient that I hold very close to my heart. Her name is Cindy Pretorius,
Mm-hmm.
and she actually had an invasive basal cell carcinoma that needed to be surgically excised. But that carcinoma was literally sitting on the entire hairline region on the front.
Mm.
So when they removed it, they then put a skin graft, but her hairline literally went straight here and they had a big gap here. So I think for the longest time, and this female is quite young, she's still in her 20s, she either had to wear wigs, she either had to wear bandanas. She could never just be present with her hair being in its natural self.
Mm.
And we came through, and just understanding the emotional toll that this was placing on such a young individual, we then went ahead and done the surgery, which was incredibly successful. And seeing the difference it made in her life in particular, because we stayed very close to this patient, and seeing the difference it's made to her, the confidence she regained, the self-esteem that she now has, and the fact that she can now move around freely without ever having the sequelae of cancer or the visible nature of the cancer on her scalp. I think that was the first and key reason why I was particularly interested in this topic, to help as many people as possible. So in the past, I think a lot of post-cancer survivors would utilize hair pieces, hair systems, wigs, etc., to get
Mm.
them back into that normality or normal space again. But I think a lot of people have hesitancy with that as well because it tends to change their entire persona. When they're wearing the piece, they're one individual. When they take their piece off at night again, they become a different individual. And giving one their own hair back again is something that I think is more than just the aesthetic benefit. It's giving them a piece of their life back again. And I think that is particularly why this initiative is so important to us as a hair clinic. Even though we have patients coming for a variety of different reasons, being able to help someone that often feels helpless is the main reason we do what we do.
Mm. Doctor, also chemotherapy and radiation, they definitely do save lives, but often they leave such lasting reminders. Is are you privy to the psychological? You've spoken about how it affects the personality. Talking about your case study there, who because of the skin graft, they could not have the full hair as they used to. And with wigs, you how confident you can just tackle the day. Then when you get home, you take it off, you're reminded of the traumatic experience of having to live or survive cancer. How severe are the psychological impacts? Because I can understand you can restore someone's hair, but also that element is also important to kind of tap into the psyche as well.
100%. And when we deal with cancer in particular, we often have a disciplinary team where you have doctors or specialists from a variety of different fields that would work with that patient together to not only just beat the cancer, which is 100% the most important thing, but then also to help with the psychological impact of chemotherapy, radiation, etc. So psychologists, psychiatrists are often part of that disciplinary team. But we have found a very sort of fortunate place in that journey, because what we found is that not many people talk about the aesthetic impact that this all of has on a patient.
Mm.
What I mean by that is the focus is always, as I said earlier, to beat the cancer and then just have a little bit of that psychological support to prevent anxiety, to prevent depression. But what the focus was never on is how do we make that person feel whole again? How do we make that person feel like themselves
Mm.
before they had to undergo the hardship of cancer? And cancer in itself is such a large speciality. I mean, doctors specialize 5, 6 years post their medical degree to become specialists in oncology. It's such a wide field, and there's so many different types of cancer. And where we fill in is to give patients that hope that, listen, even though you're going through something quite let's call it troublesome or tough at this particular point, there is a light at the end of the tunnel. And there are options that we can use, either surgical or non-surgical, to make you feel whole again and make you feel like yourselves again. So, hair is often something that gets quite overlooked when it comes to the entire disease spectrum of cancer. Again, it's more old school thinking, because the fight is always to just survive, and once you've survived, great, there's nothing else to worry about. But I think nowadays, with the more modern way of dealing with medicine, with the aesthetic space, with the anti-aging space, people are becoming a lot more concerned about their looks post the journey, because they don't want to always constantly be reminded of the fact that they had to go through such a troublesome journey. So I think getting one's hair back doesn't just give them the hair back, it's the psychological impact that it has on them. And what I've seen, particularly from my patients, it's that confidence that it gives them, making them feel like themselves again, making them tackle the day feeling 100% like the person they did before the cancer journey. And I can see it with tears in their eyes, tears in our eyes, when we go through the journey and get the patient their hair back and give them that confidence back. It just allows them to feel whole again. And once again, that's the most important reason of why we have partnered up with CANSA. It's to help as many survivors as possible, but to give them a sense of hope, and to give them a sense of not just hope therapy, but real world solutions that can really positively impact their life going forward.
Yes, doctor. And are there any specific stories or experiences of survivors that illustrate the impact of this initiative? I think you did share,
Yes.
the case study earlier on. Do you have any more as we wrap up our conversation today?
100%. So Cindy Pretorius is one really important one that went through a surgical intervention that needed a bit of surgical rectification from a hair transplant perspective. But what we found is a lot of post-chemotherapy patients, and I don't have the names on hand or haven't been given the go-ahead to use some of the other names of patients that we have, but we've got a large variety of patients that are post-chemo survivors, particularly our female patients that undergo breast cancer that is amenable to chemotherapy. They tend to shed and lose a lot of their hair. The minute they are in remission, we are starting the regenerative processes to get their hair back again. Because what chemotherapy in essence does is it takes the hair follicle all the way back to the newborn phase. So if any of the viewers or yourself have had kids, you'd know that when the hair starts growing on a child, it's very thin, it's wimpy, flaky, it doesn't have that strength and density to it. And sometimes, if you don't intervene at the right stage, that hair can almost remain in those phases for many years on end. So the minute we get into with the patient, and the minute we get them to remission, we can start our regenerative therapies such as Armani PRP therapy, there's mesotherapy. We've just launched a new sort of treatment service called Armani exosomes therapy, which is very similar to stem cells. And I'm doing this because it's not true stem cell therapy, but it's very similar to stem cell therapy to start regenerating those newborn follicles and get them back to their adult phases. And the earlier you intervene, the earlier you start that regenerative process, the quicker and better you can get the hair back to its original space again.
How can the public support this initiative?
So I think the first and most important thing is, if you personally know or are personally affected by anyone that is a cancer survivor or is going through the cancer initiative, where they're battling with hair loss or battling with even just the psychological impact of what may come from chemotherapy, radiation, etc., I think the first place would be to schedule a consultation with us. All patients coming through the cancer initiative will come through. We've got complimentary assessments for them, complimentary examinations, and we are heavily subsidized by our head office as well to help make these treatments even more affordable for the patient. So the public can help by identifying people in need, directing them directly to us, either directly to Alvi Armani or via the Cancer Association coming through to us, and we'll be able to start the conversation, understand their journey, and play a significant role and also guide them as to when we can come through with either regenerative or surgical options to get them back to where they need to be.
All right. Thank you so much, Doctor, for talking to us this morning. And I've seen Alvi Armani on social media. So for more information, I think then this will also be displayed there, correct?
100%. I think the best and first and most easiest place to start would be our website, which is alviarmani.co.za. All the information that is required is on there. And I always tell patients, don't leave it for too long. The minute you start noticing that you are having an issue, be it physically or emotionally, let's start that journey because there are ways in which we can help and support.
Right. Thank you so much once again, Doctor, for talking to us on
Thanks,
Out and
Puleng. Take
About.
care.
And that was Dr. Kalan from Alvi Armani. It is now 17 minutes before top of the hour, 11 o'clock Central African time. There we will give you our last bulletin of the day, but then you and I will continue nicely after 11 o'clock, making our way to 12 midday. It's a bright, warm, sunny day in Joburg that was looking kind of not sure if it's going to rain or not. But either way, we have welcomed spring and summer. We are loving it so far. We are embracing it in all its glory. So if you're still wondering what to do today, I'll give you one more reason. I've got a bunch of events that are coming. So stick around for that.